I often get patients that come into the office either having had children or having had massive weight loss, things that have resulted in a lot of changes in their body and not in just one area. So consequently, we see folks who oftentimes want to do pretty much head-to-toe type of surgeries. The patients are motivated because oftentimes they're going to save a little bit of money by rolling these procedures all into one. They're going to have one recovery instead of multiple different recoveries. And our job is to make sure that whatever we recommend to them is, number one, going to be safe, and number two, going to make sense for them in terms of the aesthetic result. So what we want to do is, when we evaluate these patients, is look over what's going on and start to prioritize for them really what their concerns are, and then start trying to deal with what we think is going to give them the biggest bang for their buck, because the biggest priority when it comes to these long procedures, of course, is their safety. We know that increased length of surgical time does increase risks, so we try to keep it within a reasonable time frame. And when I say reasonable, for most of us, we find that 6-hour time frame is a pretty safe benchmark. Then after that, we have to start looking at other things, because there are some particular procedures that we know are especially concerning when it comes to certain parameters for safety, and liposuction will be one of those. We know that there are a certain level and a certain volume of liposuction that we can do at one time before we start to run some high risks of actually taking out so much fat they have blood loss that can affect their health. The hallmark of a really good, committed, board-certified plastic surgeon is that we really try to make certain that whatever we're going to allow the patient to go through is something that's in their best interest.